Good morning, good afternoon, everyone. I have the pleasure of introducing Andre Schell from Belize. Andre is a first-year DRPH student at the School of Public Health here in Albany, New York, at the University at Albany, State University, New York. We were fortunate to have him as a summer intern working on some very I would say pioneering work on looking at campaign integration in the context of Latin America and neglected infectious diseases. So I'm going to let him go ahead and get started. We're looking forward to the discussion afterwards. Andre, please go ahead.
Thank you, David. First of all, a pleasant good morning to everyone, and thank you, Eva, and the entire team at HCE for granting me this opportunity to present highlights of my summer internship with PAHO and HCE. Today, I will be presenting, as I mentioned, some brief highlights on a landscape analysis that we did over the summer as it relates to health campaign integration related to neglected infectious diseases, also NIDs in Latin America and the Caribbean. As David mentioned, I am Andre, I'm from Belize. I worked over the summer with HCE, and I'm a second year DRPH student at the School of Public Health at State University of New York at Albany. Next slide, please. So before I begin, a brief introduction. We know that the experience of health campaign integration for neglected infectious diseases are not adequately documented in the region of Latin America and the Caribbean. But there is, like everything, there is hope in the horizon with PAHO's Diseases Elimination Initiative, which emphasizes the importance of integrated efforts and to end NIDs transmission. And this is through a integrated, sustainable framework for the elimination of communicable diseases in the Americas that countries use as a guidance. LAC countries have also have used integrated health campaigns and interventions to advance communicable diseases elimination, particularly of NIDs. What we also noted is that since 2003, what started as vaccination weeks in the Americas have also provided a very important platform that countries have used to integrate multiple integrations such as vaccines and deworming. So the objectives of this landscape analysis, number one was to provide an overview of experiences and processes with conducting integrated health campaigns in the LAC region related to 3 NIDs. These are cell-transmitted helminthiasis, trachoma, and lymphatic filariasis. Number 2 was to summarize best practices, successes, gaps, and challenges from past experiences. And the third objective was to highlight ways to improve the effectiveness and reach of these integrated health campaigns. Methods, we conducted a retrospective analysis focusing on high-profile health campaign integration in Honduras, Colombia, and Guyana on the 3 specific NIDs mentioned. Now, it is important to also mention why we chose these 3 countries, and this is mainly to have a full geographic representation of the region. Honduras being from Central America, Colombia being from South America, and Guyana, of course, from the Caribbean. And also because of the amount of information that was available in these countries and the expert guidance also from the Pan American Health Organization headquarters in Washington and also the country offices. This was a 2-step landscape analysis. The first step included a rapid literature review, which included both published and gray literature within the past 10 years in both English and Spanish. Then the second step was a qualitative key informant interviews with PAHO country offices in Honduras, Colombia, and Guyana. As mentioned, these KIIs were conducted with the country offices in July 2021. We analyzed data using an unstructured thematic content analysis approach using Microsoft Word. Next, please. So when it comes to the findings, I'll briefly go through country per country. In Honduras, in 2010, they formed a national steering committee for NIDs. And then they were the They launched the region's first integrated national plan to control and eliminate 9 NIDs in their strategic plan. They also piloted integrated deworming campaign in 2012 for children ages 2 to 4 during what is National Immunization Week in 2 municipalities. It is also important to note that this pilot then moved to 6 municipalities, and then it later became a national campaign, which was included in the annual Vaccination Week in Americas by 2014. Integrated NID and school health programs were also conducted for deworming campaigns for children in schools, and this was done through the strong collaboration between the Ministries of Health and Education. Some of the key challenges and barriers that Honduras reported as it relates to NID campaign integration include the shortage of human resources for health, limited financial resources, the lack of proper strategic planning, and overall concerns about the sustainability of the program in a longer run. When it comes to Colombia now, it is important to note that they were the first country in the world to successfully eliminate onchocerciasis in 2013, which triggered the launch of a national plan to control and eliminate soil-transmitted helminthiasis and trachoma. They have a targeted population which used mass drug administration. There are almost 200,000 people in areas for elimination of trachoma, and there are 3.2 million children aged 1 to 14 years for deworming. What they used in Colombia are these integrated surgical camps with deworming and trachoma treatment, and these targeted the indigenous populations of the Amazon and the Orinoco. Integrated deworming campaigns for children attending school, and for preschool age children, this was done via annual vaccination campaigns. Challenges that Colombia reported now, one of their main challenges was actually the influx of migrants. They had to be changing their services and also the whole scope of these integrated health campaigns. A shortage of HRH was also an issue for Colombia, competing health priorities, and limited finances as well. Now, Guyana, as we move now to Guyana, in 2019, they developed a strategic plan to eliminate LF through mass drug administration using a triple therapy, also targeting scabies and soil-transmitted helminths. 3 approaches of MDA program, they distributed at primary and secondary schools. They also distributed through fixed points in work and public places, and they also did house-to-house distribution. They also conducted school-based campaigns to combat LF and STH, and they achieved actually more than 70% MDA through the triple therapy national coverage in 2017, 2018, and 2019 and 2021. And we know that the minimum coverage for this is 65%. So they have been doing pretty well. They are currently also exploring the inclusion of integrating health campaigns under one national NID strategic plan with leishmaniasis and other NIDs, because they found out and they saw how important and how successful previous campaigns were. So they are now trying to integrate, making sure to integrate these health campaigns in one sole NID strategic plan. If they are able to do so, this will be a document first of the kind for the country. When it comes to the challenges, they had weak coordination of activities with school, limited financial and human resources, and again, competing health priorities, and also engaging teachers and parents in schools. So what we did is then we came up with cross-cutting themes, and we have like experiences, achievements, enablers, and also gaps and challenges. When it comes to cross-cutting themes and experiences, we saw that countries integrated no more than 2 health services at a time. We also saw that 2 countries integrated within the NID realm, which of course are the 3 NIDs that we studied, while one being Honduras included vaccination in their campaigns. We saw too that integration started at a small scale and then expanded to other geographic areas and target group. As we saw, they had pilot studies and then they eventually moved on to more regions, and then it became something nationally. And also one country relied on external donors for operational costs. And we also saw that 2 countries almost fully funded campaigns. When it comes to the NID strategic plans and vaccination campaigns, these are fully funded by the government in these respective countries. As for achievements, we saw high coverage for NID integrated campaigns in Guyana and Honduras. Actively engaged stakeholders. This also made strong efforts. They also made strong efforts to train and sensitize teachers and parents. This was also in strong collaboration with the ministries of education, which played a vital role. They were also successful in the effective adaptation of national plans and interventions at the national and local levels. And this was done through the proper launching of these health campaigns through social media, through radio stations, TV stations, etc. And also the strong, as I mentioned, intersectoral collaboration between the ministries of health and education played a very important role in these campaigns. When it comes to the enablers, effective high-level multi-sectoral support. Yes,
Andre, I'm going to give you a 2-minute warning.
Sure, thank you. So we saw that effective high-level multi-sectoral support was one of the strong enablers. Also collaboration via intersectoral committees and working groups. Consistent effective communication strategies to help serve target population, and also community engagement from an cultural perspective. Now, as I mentioned, through country per country, these gaps and challenges, they were from limited financial and human resources, coverage gaps, weak coordination, and campaign fatigue was also seen in the countries. And we know that Latin America is a very complex region, so complicated political climate and migration were also some gaps and challenges. So in light of these findings, we recommend the following actionable recommendations for the LAC region. To comprehensively document campaign integration experiences. We also recommend for countries to strengthen intersectoral collaboration and communication strategies among local and regional partners, and to ensure a consistent approach to community engagement. We also recommend for countries to consider health campaign integration as a pillar to contribute to reduce disease burden and improve overall health outcomes. And again, this can be PAHO's initiative to eliminate more than 30 communicable diseases is a good opportunity for them to do so. Number 4, we also recommend for them to strengthen management capacity and planning processes to better execute these health campaign integration. Number 5, to avail resources for coverage surveys and other measures of effectiveness. And lastly, for them to consolidate and strengthen leadership and governance at all levels to ensure planning for sustainability of these integrated health campaigns. And that's it. Thank you very much.